Hello, a very warm welcome to all. I'd like to begin by acknowledging the traditional custodians of country throughout Australia and their connections to land, sea and community, and pay our respects to their elders, past, present and emerging. And to all the Aboriginal and Torres Strait Islander peoples today. I'd also like to extend that respect to the diverse Indigenous peoples who have connection to the lands from where you're all dialing in today. So thanks for joining us. I'm Joanna Mott, otherwise known as Jose, Gender and Social Inclusion Advisor on the Fund Coordinator team for Water for Women, and very much looking forward to being the facilitator for today's session. The Water for Women Fund is the Australian Government's flagship program, working with civil society and research organisations to deliver inclusive, equitable and sustainable wash projects in 15 countries across the Asia-Pacific region. So the reason why we're all here today is because it's a very important day, as we know. It's about ensuring that menstrual health and hygiene gets the attention and visibility it deserves. But as we well know, it cannot just be one day, it must be every day. Making menstrual health and hygiene pivotal in WASH programs goes a long way in ending the debilitating stigma that keeps people silent on the issue. Breaking that silence and taking action is key to ending period poverty. Fund partners have been doing this by prioritising menstrual health and hygiene in their WASH projects, particularly through their COVID-19 responses. A recent fund review undertaken shows the diverse ways this is being done, some of which we will hear about today. Findings from the review have informed our learning brief, which we are very excited to launch at the end. So before going forward, just a few housekeeping matters. We have two feeds today, the chat and the Q&A. So we'd like the chat for comments and feedback, including introducing yourself if you haven't already done so. It's great to see everyone already doing that. And also the Q&A for questions to the panel. This also enables you to upvote questions, as we may have to prioritise questions due to time constraints. We'll also be using Mentimeter at the end of the session, so please have your mobile phones handy. And also view settings. We recommend speaker view for presentations and gallery view for panel discussions. You're able to access that in the right-hand top corner, the icon at the top corner. Also, just to let you know, to ensure greater accessibility to this session, we've enabled Zoom's live transcript functionality. So the slide shows you how to access that in the toolbar below. Okay, so today we'll be hearing from a mix of Water for Women partners and other organisations. As you can see, we have a wide array, and they'll be sharing about what they will be doing to make menstrual health and hygiene pivotal rather than peripheral through their work. I will introduce each speaker before each presentation, but first I would like to hand over to Renee Paxton from the Water section of the Australian Government's Department of Foreign Affairs and Trade to say a few words about the Australian Government's investments in menstrual health and hygiene. Thanks, Renee. Over to you.
Great, thanks, Jose. Hello, everyone. I'd like to welcome you on behalf of Australia's Department of Foreign Affairs and Trade today to today's webinar, Pivotal Not Peripheral. DFAT is very pleased to be involved in this webinar that has been organised by our flagship WASH program, the Water for Women Fund, to mark Menstrual Hygiene Day. I would also like to acknowledge the traditional owners on the lands on which we work and live, and pay my respects to them and their cultures, and to elders past, present and emerging. The Australian Government supports a focus on water and WASH through many initiatives across the Indo-Pacific, including through the Water for Women Fund, the World Bank Global Water Security and Sanitation Partnership, through a range of our bilateral investments, the Australian NGO Cooperation Programme, support to WHO and UNICEF, just to name a few. A crucial part of this work is supporting menstrual health and hygiene. We believe the WASH sector has a pivotal role to play in supporting safe and dignified menstruation management to positively impact the life course of women and girls who menstruate. Australia supports the 2030 Agenda, including SDG 6. To achieve SDG 6.2, access to adequate sanitation for all, the WASH sector can and must prioritise menstrual health and hygiene in WASH programming. Making menstruation pivotal in WASH requires a whole of systems approach. This includes strengthening supply chains and empowering women and girls, undoing stigma and harmful norms that perpetuate myths of menstruation as dirty and shameful, and ensuring toilets in schools, at health facilities, in institutions and workplaces, as well as in the home, are menstrual hygiene friendly. Water for Women has a strong focus on menstrual health and hygiene, with 14 of the civil society projects across the Indo-Pacific integrating menstrual health and hygiene into their inclusive WASH programming. It's fantastic to see the range of different approaches being used, including information provision and awareness raising activities in schools, healthcare facilities and communities, menstrual hygiene, friendly infrastructure design, engaging with men and boys to actively address stigma and taboos, working with governments to integrate menstrual health and hygiene in WASH policies and planning, supporting women's livelihoods through pad production, and supporting women and girls with disabilities. The World Bank Water Global Practice is also an important partner for DFAT. Our work together on the Global Water Security and Sanitation Partnership enables leading research and innovative approaches to water and WASH. The World Bank estimates over 500 million women and girls lack adequate facilities to manage their menstruation. I'm very excited to hear from some of our Water for Women partners, the World Bank and WaterAid and the Pacific Menstrual Health Network today, who are working to make menstrual health and hygiene pivotal, not peripheral. I hope you find today's panel discussion interesting and informative. I would now like to hand back to Jo Smott, who is facilitating today's panel session. Thank you.
Thank you so much, Renee. Thanks for that overview. Yes, so let's kick off. We are very lucky to have Alice Lee and Chloe Morrison with us today from World Vision, from one of our fund partners, World Vision Vanuatu. Alice is the Inclusion Operations Manager and Chloe is the Program Quality Manager. And they're going to talk about their Lautem Dak Kona, which is their Gender Equitable and Disability Accessibility WASH project in Vanuatu. And they will be talking about what they are doing for women and girls with disability in regard to MHH. Thank you. Over to you, Alice and Chloe.
Okay, thanks, Joyce. We all know that accessible access to water and sanitation is essential for health and well-being. For people with disabilities or people who menstruate or experience incontinence, often experience unmet WASH needs. And there's very little data about these experiences. In 2019, World Vision and a host of partners carried out a Water, Women and Disability study that explored the intersection between gender, disability, menstruation and incontinence. And what we found wasn't shocking or surprising, but there were widespread cultural taboos about menstruation in Vanuatu. And what was interesting was that these beliefs were believed by all participants in the qualitative study, with no difference as to whether people were based in rural or urban areas, or whether they had a disability or did not. What we found was that all participants believed that menstruating women and girls will kill crops if they touch them, and therefore mustn't work in gardens, they shouldn't cook food for others. And as a result, they also believed that they should collect their own water for bathing and washing their menstrual product, that they should use separate latrines and bathing shelters. Now, whilst there were no differences in these beliefs, what the study found was that the impacts of these menstrual beliefs more negatively affected women and girls with a disability who require more support. Next slide, please. The photos on the screen are from Litty, who has a mobility impairment, and they clearly demonstrate the layered difficulties that she faces when she menstruates. The implications of needing to collect water, to bathe separately, and to manage washing and going to the toilet on her own. You can very clearly see in these three photographs how sociocultural beliefs that dictate that women must do these things on their own when menstruating have a very clear impact on people with disabilities that aren't felt to the same extent by people without disabilities. And Litty also reported that when she menstruates, she also experiences a lot of pain because of the increased exertion that she faces when she does these tasks on her own. The impact of menstruation and subsequently the taboos and cultural beliefs on people with disability goes just beyond their health. So the study also found that women and girls with disabilities were statistically nearly twice as likely than people without disabilities to miss out on social activities when menstruating. This isn't just, menstrual health and hygiene isn't just pivotal then to women's health, but it's really pivotal to all of the things that we do in development: access to education, economic development, community participation, and governance. Next slide, please, and over to you, Elise.
The World Vision Vanuatu Inclusive Portfolio have learned that each impairment is specific in terms of its needs. Therefore, we aim to use an individualized approach to target the specific needs of each person living with an impairment. Carers have been phenomenal in performing this vital and pivotal role in supporting those who live with an impairment. For example, those who are experiencing some memory or concentrating functional limitations are constantly reminded on how to use and change a menstrual product, also emphasizing the importance of bathing and keeping hygienic. For those needing extra self-care support, these are like changing of pads and soiled clothing, and support to those with vision and mobility impairment, like collecting water, accessing wash facilities, cooking, and washing dishes. Next slide, please. The Lighten Our Corner project aims to deliver several approaches to improve wash outcomes for people with disabilities for women and girls who menstruate. It's not a one-size-fits-all approach. Support needs to be tailored depending on impairment type and also context, such as urban or rural. The following strategies have been developed to help provide the necessary support. Firstly, develop carers curriculum that includes functional strategies on how to support people with disabilities when menstruating. Secondly, develop menstrual health and hygiene curriculum for both women and girls, men and boys, to address the cultural taboos and norms. Thirdly, partnered with Mama's Life, a menstrual social enterprise, to pilot reusable menstrual products for people with disabilities. Fourthly, increasing access to accessible latrines in providing individual commodes that can help people with disabilities better manage menstruation and incontinence. Lastly, working with communities to make sure that the drinking water safety and security plans includes actions to make water points more accessible for people with a disability. Next slide, please. For more information, you can access through the following links and also be able to reach out to Chloe Morrison and myself for further comments or questions. Thank you.
Thank you so much, Alice and Chloe. What an interesting presentation, and particularly for taking us through, you know, what those increased impacts look like for women and girls with disabilities, and how, you know, menstrual health and hygiene, proper access to it, really has a holistic effect on how they can participate in their communities. And I really liked also how you talked about you know, that a one-size-fits-all approach cannot work because there are many different contexts that one has to take into account for women and girls, including those with disabilities. Thank you very much. Okay, now we're looking at a presentation from Sylvia Davina, who is the WASH and Early Childhood Development Advisor from the Yayasan Plan International Indonesia. And they will be talking to us, Sylvia will be talking to us about the Wash and Beyond Transforming Lives in Eastern Indonesia, the Water for Women Wash project. And their focus will be on system strengthening in schools, menstrual health and hygiene system strengthening. Thank you. Over to you, Sylvia.
Okay, thank you, Jo. And hello, everyone. I'm Sylvia Devina, the WASH and ECD advisor at Plan Indonesia. Today, I'll be presenting about how menstrual health and hygiene is pivotal and not peripheral, especially in our project areas for WASH and Beyond. So WASH and Beyond project in Indonesia is benefiting more than 500,000 people in 2 districts and 2 provinces in Indonesia. Our theory of change consists of 4 different outcomes, and one outcome is specifically on working with marginalized people, especially women and people with disability. And then menstrual health and hygiene has been very important in our work in WASH because we also work in tackling the taboos around menstruation and also stigma around menstruation. So these are our 2 districts area in Sumbawa and in Manggarai. Next, please. So here are some examples of our work. We work in 4 different outcomes, system strengthening, and we also work in GESI, gender equality and social inclusion, and beyond WASH, and also in evidence and influence. We work in partnership with women, people with disability, and also with government at the district and at the province level. We found it very important, especially because we work with them and making sure that they support our policy and also support in funding our interventions. And in terms of online peer educators, we also work in peer educating them in soft skills, for example, in public speaking and how to do peer educators using online social media account, for example. And we also work in WASH and JC and on how to tackle stigma and build individual and collective agency to our peer educators. And we also have a module, menstrual health and hygiene module, which will be rolled out with the help of the national government from the Ministry of Health, Education and Culture, and Religious Affairs. Next, please. So we also have an intervention which always included people with disability. We map out 20 model schools in 2 different districts, which include primary schools, secondary schools, and also special needs school. And we work together in co-designing toilet and MHH friendly and accessible toilets with the help of our people with disability organization. As you see in the example and the pictures on the right-hand side, they are helping us doing accessibility checks and co-designing the MHH friendly and inclusive toilets. And after that, we also developed them with the help of the peer educators, as well as when we are doing our pilot intervention, we are piloting using reusable pants, menstrual pants, which is with the help and support of Plan Australia. We're able to do this pilot and is quite successful. With the help of the government also, we managed to distribute 1,000 reusable pants, menstrual pants, to our project areas. As you see in the picture, she's one of the beneficiary, Andin from the special needs school. And this is very important to pilot this because we found that we need to be more environmental friendly and think ahead of the climate change challenges. Next, please. Here are our challenges and barriers. First, due to COVID-19, we found that we have to adjust to online methods and we have to postpone the face-to-face implementation. The second one, we found there are limited school budget and national budget that can only be used for maintenance, but not for building new toilets. We also found that there are limited space to build inclusive and MHM or MHH friendly toilets. We also found there are challenges in shifting the beliefs and attitudes around gender and inclusion, including taboos around menstruation. This is a picture of Isti and her husband using the reusable pants, and they have discussed how to use them and discuss it with her husband. Next, please. So here are the lessons learned. First, we found that it is important to build a partnership with the government, with disability people organization, as well as with the women's organization. We also found that it is crucial to gain commitment from the government and schools at the beginning for institutional sustainability, for financial support, and also in the future to roll it out in the curriculum and for the maintenance of the toilets. We found that building agency of girls and boys has been the key to successful peer educators. And we also found that it is important to ensure involvement of people with disability who menstruate to increase gender equality and social inclusion outcomes, including inclusive wash facilities. So those are the things we learned so far, and hopefully we will improve in the next stages of the project. Next, please. So that's it. I hope it is useful and beneficial to all our participants. Terima kasih from Indonesia and thank you. Thank you, everyone.
Thanks so much for that, Sylvia. Gosh, so much was packed in that short amount of time, and really liked how you were able to look at, you know, how the project looks at physical infrastructure around disability accessibility and menstrual hygiene friendly accessibility, and then how you're also working on tackling the stigma that's so entrenched around menstruation, and the critical role that that rights holder organisations play that you're working with in overcoming some of that with the DPOs and the women's organisations. Thanks, Sylvia.
Thank
Okay.
you, Jo.
Yeah. Okay, next up we have Akila Savadas, who is from the Centre for Advocacy and Research in India, CFAR, another fund partner organisation, and she will be talking about the Water for Women Wash project, through the Water for Women Wash project, on mobilising, facilitating and replicating socially inclusive wash initiatives in India's urban slums. And the particular focus of Akila's presentation is how they responded to the COVID response how menstrual health and hygiene was really integrated into their COVID response. Thanks. Over to you, Akila.
My video has to be put on. Thank you, Jose. Thank you for the introduction, and thanks to the Water for Women Fund for giving us the opportunity to present. If we go to the first slide, the title slide, it's quite self-explanatory. It tells you how the women and girls from the two cities of Bhubaneswar in the state capital of the province Odisha, and Jaipur, the state capital of the province of Rajasthan, decided that MHHM, or menstrual health and hygiene, has to become everyone's agenda and business, and that it cannot be buttonholed into just a women and girl alone issue. And in both the wards in both the cities, we worked in one ward each, with Bhubaneswar having a population of more than 12,000, with 47% representing women and girls. And in Jaipur, with over 14,000, with about 52% representing women and girls. Next slide tells you about the concerns and challenges that we faced. Very important, because COVID became a turning point. The pandemic brought to the fore all the sort of age-old neglect and discrimination, indifference of all concern. Even the modicum of service and support and program collapsed. Women were left to fend for themselves, and the home, certainly not a nurturing or a protective space. All the unequal norms were sort of, haunting them. And even though they were all locked up in separate spaces, they all decided that enough is enough, time to speak and act, and build what they called a localized and a saturated response. Let's go to the next slide. There we actually go into what they did in terms of self-diagnosis, because they felt that it was time to speak up, reclaim their dignity, build local solutions, and if possible, kindle the conscience of others and, sort of bring people around. Situational assessment, not only by women and girls, but by all their allies and stakeholders, revealed the kind of pain and trauma they had gone through, particularly women and girls with disability, given their dependence on community toilets, public taps, and having the burden of living in homes with insanitary toilets. All the modicum of service, as I said earlier, was collapsed, and the home became a site of conflict and stress, because the men, boys, and the older people just could not understand the predicament that women and girls were going through. And in fact, in some cases, even became uncaring. You go to the other side of the slide, you find that they decided now enough is enough. They'll speak up in every public and private space, and ensure that they bring a critical group of people to co-campaign and co-educate people and change people's mindset, attitudes, and norms. Together they will act, because nothing demonstrates better than action, and then bring all the stakeholders in, build local leadership, create what is called a people's movement, and then also innovate side by side. The innovations that they did, the one, start storing pads and sanitary napkins so that they're not left high and dry. Second was to not only spread education on menstrual health and hygiene, but also provide psychosocial support. And third was actually to produce something that was sustainable and safe, a product that is a biodegradable. Go to the next slide. The first innovation on the pad bank was triggered not only by the unequal norms, but by the fact that the government did not list napkins as sanitary napkins as an essential product. So not only were the shops closed, but all the emergency relief had no provisioning for it. More importantly, everybody was charged the kind of pain and trauma the women had gone through. They all came together, pulled in money, bought napkins, partly from the market, partly from the napkin unit that was producing biodegradable. They collected almost 3,000 pads. Some of it was sold, some of it was distributed free, depending on the needs of people. And they established that very important point about self-reliance, and that they're not going to beg, hold their hands, and beseech to people when they're in crisis. And now they're going to scale this up. Next slide actually tells you how they went about working on the psychosocial support. 3 sets of people they worked with, spearheaded it. One, women and girls with disability. You can see both Jumri, a young girl, and Kali Devi, a middle-aged woman, taking up the mantle of education and providing psychosocial support. Jumri went into schools, colleges with young people, built study groups and workshops. Kali Devi went into religious meetings, mothers' meetings, community meetings, and started changing attitudes. In the next slide, you will find, the frontline workers also jumped into the whole thing. They are a huge number of people, so they integrated it into all their activities once the lockdown was, relaxed, and made it part of their, made it mandatory in each of their activities, and created what is called a sense of, engagement of the system and the state. The men went straight into the family, started changing norms, went into with other men, went into local leaders, went with, people that were actually sort of, hindering and hampering processes, and tried to change attitudes. Together, they made a big difference. And while this was happening on, next slide was actually the sanitary napkin unit producing the biodegradable napkins. In both cities, we had set up one unit each, very successful to begin with, actually set it up and even sold. Now they're facing challenges because the product needs to be, the user is not satisfied. They've already gone into retraining and getting a new mold so that they could redesign the product. And more importantly, they will have to do consumer user education, because the competition from the products in the market is very, very high, and they really have to build in the message of eco-friendly and something that is locally produced, and to sustain local economies and local production. Lastly, when we come into the achievements, we actually scaled up. Last slide, achievement slide, actually find that it was led by women and girls, then became what is called 157 of them then became an all-stakeholder movement with 600 change agents. A lot of attitudes and practices got changed, looked into, inquired and changed. A lot of stakeholders, right from bilateral agencies, government to local stakeholders to implementers, became part of the process. And the whole idea of saturating actually went to the extent of, reaching out to 14% or nearly 15% in both cities, and about 5,000, nearly about 5,700 people were reached out to, not only with information, education, but also a lot of negotiating skills were, imparted to them by the women and girls and the change agents. And of course, we are going to continue to strengthen all the innovations that we had started. Way forward are very simple. The last slide, the way forward is very simple. We're going to scale this up across wards. There is also already an enthusiasm from other wards to sort of, emulate this practice. We are going to build a curriculum that's not only centered on knowledge, information, but also on the negotiating skills. What do you do to change attitudes and gender norms? And of course, institutionalize it across all the sort of, centers, whether it's health center, school, or, the childcare centers, or even the legal aid centers. Everywhere we will institutionalize it. And of course, not only talk about eco-friendly products, but now taking off from what Sylvia said, also look at, menstrual plan and other products. So with this, I end, and my last two slides are really acknowledgement, both to Water for Women and all my, compatriots who are part of this. They were part of this entire sort of, movement of change. And we are very confident that the next 2 years, we're going to really see a paradigm shift. Thank you. Thank you, Jose.
Thank you so much, Akila. Again, a lot jam-packed into 5 minutes. Wow. I was really struck by what you said around, the multifaceted approach that this project has for addressing menstrual health and hygiene through the COVID response, and, really having that stepped out situation assessment, and to ensure all the stakeholders involved in changing those norms. And that it's really, as you say, driven by people's movement, starting with those who are affected, adolescent girls, women and girls with disabilities. Thank you very much, Akila. Okay, we're on to our next one, our fourth presentation. And this one is actually is about the Pacific Menstrual Health Network, which WaterAid Australia coordinates, and is another initiative funded by the Australian government. It's Australian government's NGO cooperation program. And we are very lucky to have Chelsea Huggett with us today, who is the Equality and Inclusion Advisor for WaterAid Australia. And this is really a focus on looking at the holistic focus for menstrual health and hygiene, and how the Pacific Menstrual Health Network is really engaging with different groups, women's groups and other activists. Thanks, Chelsea, over to you.
Thanks, Jose. Happy Menstrual Hygiene Day, everybody. It's hard to believe that we're here again. That's the whole year ago. I'd just like to acknowledge that I'm calling in from the land of the Tongarong people, and pay my respects to their elders past, present and emerging. It's really exciting to be here today and to share with you about the Pacific Menstrual Hygiene or Health Network that WaterAid's been supporting over the last year. So you may have heard of this before because we have been sharing it around quite a bit. It's a collaboration or a movement between about 7 local partners across the Pacific. So Calico Stay Free in the Solomon Islands, Mana Care in Samoa. In Fiji, it's with FWRM and Diva for Equality. In Papua New Guinea, it's with Queen's Pads, and in Vanuatu, Mama's Life, and the Pacific Disability Forum as well. So on the next slide, I'll share with you some background about the purpose of the network and what the aim is. So this came about a couple of years ago. There's been lots of requests for how can we share learning across the region So even today, we've heard about all of these, great efforts that are happening, but given the Pacific is quite spread out and quite small, what we've seen is that there's this interest in bringing together learning and doing joint and shared advocacy more as a collective. So the group have been working together to really galvanize action. So doing partnership and collaboration for change, learning and building the evidence base. So presenting evidence at webinars and disseminating what evidence is already out there so others can draw on it more. And then doing joint action and advocacy. So campaigning around Menstrual Hygiene Day, for example. So WaterAid's utilised ANCP funding to get this started, and we're collaborating a lot with the Water for Women Fund as well, recognising the essential role that WASH plays in menstrual health and hygiene. So on the next slide, you'll see the areas for action that the group have identified as being really critical. The exciting thing about this work, I think, is the cross-sectional and the cross-collaboration dimension of it. So all of those partners that I mentioned at the beginning who've been really driving and shaping it, they all come to menstrual health from a different perspective or unique perspective. Some are social enterprises, some are sexual and reproductive health actors, gender equality actors, DPO. And so we've purposely made these 7 action areas quite diverse within themselves, as the group feels that menstrual health is such a broad topic. So the group's really aiming to advocate for change around social taboos, supporting menstruators in all their diversity and community members of all ages, ensuring products are available and affordable, ensuring people who experience marginalisation are really at the centre of meeting their own menstrual health needs. So really having that voice and participation. Strengthening the evidence around menstrual health care, the quality and sustainability of WASH infrastructure throughout the Pacific, and making sure that all WASH services and systems are really MH friendly. And then really seeing more of an inclusion of menstrual health into climate change, disaster, risk reduction work, humanitarian response. So really the vision for this network is that it can be advocating for other sectors to take on board, the menstrual health cause. So on the next slide is an update of what the network's been working on recently. And just to say, I'm presenting this today, but there's a big team of people behind this who are really driving it. Just due to many factors, and COVID, partners couldn't be here today, and PIP couldn't be here today. So just to share the work that they've all been leading is doing a series of country case studies, so going out and talking to people and doing desk reviews to understand more of that, the landscape around menstrual health, to understand what the opportunities and entry points are. So people have got a really clear idea of the gaps and opportunities and can work together to address those. So Vanuatu and the Solomon Islands teams there have been working to really document the landscape and assess and understand where those gaps and opportunities lie. And some of the things I've found so far are that there's gaps in the cross-sectoral coordination and leadership among different actors, so CSOs, government. But there's been some success within training and supporting of government staff. But that's often mostly rural WASH staff who are often male as well. We've also found that actors working on menstrual health in both Solomon Islands and Vanuatu have utilised COVID and other disasters as an opportunity to integrate menstrual health into the cluster system. And I know many people on the call today are the ones working on that. But it's been interesting for us to document this evidence, and we'll be sharing this over the next couple of months as we collate them to really build that evidence base and how we can support cross-sector collaboration to progress menstrual health in the region. So on the last slide for my short 5-minute snapshot, yeah, I think this, yes, this is my last slide. So I just wanted to say that we really love hearing from people and hearing the work that you're doing on menstrual health. Our vision for the network is for it to continue beyond this startup phase. So we want to strengthen the action and integration, and actually do a bit more piloting of menstrual health approaches at the country level. So we're just looking at funding and securing some funding to support local partners to do that. But please do watch out for and promote the network. They're all campaigning today, these partners, using the hashtag Pacific Periods. They've done some great infographics, and you're always welcome to connect with the country partners on their case studies, or contact us at WaterAid. Thanks so much, Jose, and happy Menstrual Hygiene Day, everybody.
Thanks so much for that, Chelsea. Wow, just a really, amazing network that's been built, taking in so many diverse perspectives, as you say, bringing that lens, from different member groups who have diverse needs, and just, building that evidence and learning for campaigns and advocacy across the sectors is amazing. Fantastic to hear about. Thanks so much, Chelsea. Now, the last but not least, we are joined today, amazingly, because it's very late in Washington, DC, but we're joined by Sarah Keener, who is the Senior Social Development Specialist at the World Bank's Global Water Security Partnership Program. And she's here to present to us about what the World Bank is doing in terms of championing a holistic approach to menstrual health and hygiene, and acknowledging the constraints menstruating people face and key opportunities for interventions across a range of sectors. So welcome, Sarah, and thank you so much for being with us for you tonight.
Thank you so much. Thank you so much, and thank you so much to Water for Women and DFAT, and also to the Global Water Security and Sanitation Partnership for helping us to be able to do this work at the World Bank. It's fantastic to hear about the rich experiences. Next slide, please. So at the World Bank, a couple years back, I think we're a little bit behind the others, I would say, but we started to look at how we could improve, at least in our water infrastructure, menstrual health and hygiene, largely by looking at the infrastructure side and getting appropriate infrastructure. But we realized quite quickly, and by learning from others, that without products, girls would not use facilities in schools, and women and girls would not have good menstrual hygiene and menstrual health. And without products that were sustainable, we would end up with a landfill problem. And even if you had the products and the infrastructure, without sexual and reproductive health education at the right time, girls would suffer infections in early pregnancy. And finally, and if you didn't address the community level stigma, girls and adolescent girls might not be able to go to school, would still feel shame, and women also would be excluded from a host of other activities because of the stigma. So to really get the benefits of empowerment from MHH, you need many factors together. Next slide, please. And just to illustrate why this is so important for the different sectors, let me just start with education. There is some evidence, it varies, but there is some evidence that with holistic menstrual health and hygiene, there is a link between keeping girls in school. And just to step back, at the World Bank, we like to talk in numbers and aggregates, but why is that so important? Education has been referred to as a social vaccine. And if you just look at, if you get secondary education completed, you have 63% fewer child marriages, fewer child pregnancies, and the economic impact in a country like Kenya, if all adolescent girls finish secondary school, has been calculated to be an increase in the gross national product of $3.2 billion a year. So this is not just an individual issue, it's also a societal issue that's quite important. And I won't go through some of the other examples of why this is relevant for each of the sectors, but just another relevant detail. Another study found in Kenya that 10% of 15-year-old girls were selling sex for pads. So the cost of products, the availability of products is also quite important among all of these other aspects. Next slide, please. So at the World Bank, we realized that clearly we needed to bring together at least the materials and the markets or the products, the MHH appropriate facilities, water with soap, everything else, and information education at the right time and at the right place, but also within an enabling environment that was facilitating. So for example, taxation regulations on production of menstrual products, public financing and provision of menstrual products, or at least, for example, including them in conditional cash transfers, so that you create a market that then local entrepreneurs have some reliability for and can begin to produce. So you know, how do we bring all of these things together? Next slide, please. Next slide, please. So a very practical challenge, at least within the World Bank, and I think within governments that are approaching this at scale, is we tend to work in silos. So you saw we have all of these different sectors. How do you actually bring them together around some of these joint visions and joint approaches? I think it's still challenging, but we started at the World Bank a working group together with water, education, health, the gender group, and the private sector, and came together to develop a background paper and a joint resource package, mental health and resource package, which is actually publicly launched today. It's really benefiting from work that many others outside the bank, including many of those here today, have done to help educate us about how do we bring this together and create a joint vision. And I think we've seen in the last year a huge increase in the percentage of our projects that include MHH components, increasingly holistic. It's still a work in progress, but I think just to reference, I'm not sure you can see my background, but to reference my background, this is the picture today on the World Bank intranet of very senior vice presidents, directors from many different global practices, many different sectors who are now coming together to recognize that this vision is important. Next slide, please. So what is this all for? And again, coming back down to what the impact is on the ground. I spoke just last week to one of our task team leaders, Odette, who manages a project in Mozambique. This project was scaled up in the context of COVID to provide safe return to school. And that became an opportunity to really take to scale this provision of materials, the provision of appropriate infrastructure, and the provision of education and stigma reduction. And these are the girls that just recently benefited from this, who said, you know, before this, I had to stay home, I was embarrassed. And now, even during the time of COVID and coming back from COVID, I've been able to stay in school during this really difficult year. I've been able to not have to have an extra financial burden on my parents from the cost of the products. And I think most importantly, that they can now confidently manage their menses. So from the individual to the societal, this is why bringing this together is so important. Thank you very much.
Thank you so much, Sarah. You really brought out the complexities of the issue and how and the need for really strong holistic focus on menstrual health and hygiene, because there are so many different dimensions for addressing it effectively. And the importance, again, really highlighting the importance of the role menstrual health and hygiene plays in girls being able to participate at school, not just in terms of physical infrastructure, but a whole lot of other elements there that you've outlined so articulately. Thank you very much. So thank you all for your rich and insightful presentations. There's a lot in there, a lot on how you're addressing period poverty in your WASH projects, and some really, really great learnings, I think, you know, how you're addressing norms that are harmful, how you're addressing stigma, how you're taking on a multi-stakeholder approach. And I think someone in the chat talked about, you know, the engagement, seeing the engagement of men and boys and the importance of that, and really tackling norms that are harmful for women's and girls' safe and dignified menstruation. So some great examples there. Now we're moving on to the panel discussion, and we've got a couple of questions that we'd like to ask you. And yeah, we have about 10 minutes for this, and then 5 minutes to look at the Q&A, I think. So just wanting to start with the panel members here. The question of, you know, we've looked at a range of case studies here, but what exactly goes into making a toilet menstrual hygiene friendly, do you think? And I might just pass to Chelsea Huggett on this, because I know they've been doing some work on that with their menstrual hygiene friendly guidelines. Thanks, Chelsea.
Thanks, Jose. Yeah, we love a bit of toilet talk, getting into the detail. I mean, I think that essential principle of hearing from people who menstruate themselves and what their needs are has to be at the absolute core before doing any kind of design or process around toilets. So whether that's girls in school, you know, women or other people who menstruate, it could be trans men menstruating, really thinking about people and all their diversity and what their needs are going to be. I think as well, you know, with menstrual health and having friendly toilets around menstrual health, it's much broader than menstrual health itself, and thinking through things like privacy and safety. How do those people who are using those toilets feel? Making sure they're accessible to all, affordable. So really having a much more holistic approach to how we address menstrual health and inclusive sanitation, from the service level right through to the user end and the person who's using that facility or service. And I'd include in that as well things around parenting. So, you know, what sanitation facilities do parents need, or carers who are supporting a person with a disability to access that toilet or that service as well. WaterAid does have a female-friendly toilet guide. It's a really fantastic resource, which is aimed at working with government, so local government, around how to make sanitation services really accessible. So that would be one I'd recommend looking at for much more detail. I didn't mention disposal. That's, you know, really a really key part of it as well, obviously, is the ongoing operations and maintenance, and then having those safe disposal systems, which I think we sometimes forget, or that those solutions are much more longer term and require some really good collaboration to make sure the services are sustainable and remain safe and operational.
Yeah, so important, isn't it, Chelsea, in terms of sustainability and resilience of the infrastructure that's being developed. And I really liked your what you were saying about the importance of co-design to address the diverse needs of different groups of people who are menstruating, and that role of the caregiver and parents particularly, that's key. The resource that Chelsea was referring to, that will be provided at the end in the resource list, and is also listed in the learning brief that we'll be sharing at the end. Do any of the other panelists have any more comments on that? Oh, Akila, you're on mute.
I'd like to say that in the informal settlements, though it, what appears to sort of, hit you is the lack of facilities, but the real challenge is also the attitudes, the sense of both, shall we say, self-stigma, self-limitation, plus, other sort of patriarchal attitudes. So changing attitudes, creating what is called respect for people living in informal settlements, creating a rights and responsibility framework, And then definitely, building in a strong accountability. These are three things we need, before we start, bringing in bricks and mortars to create what is called better toilets or better pans or better facilities, without mobilizing people and without respecting communities and their rights. They are the productive workforce of the city. And if you don't respect them, the city will collapse. They are the city makers. And they need to be, their basic rights need to be guaranteed. Thank you.
Thank you so much, Akila. And that accountability issue is so key, isn't it? Particularly with the and that idea of creating or co-creating that rights and responsibilities framework to address that. I really like also what you said about self-stigma. That's really interesting, and creating self-respect. And respect for others is critical to addressing those harmful attitudes. Thanks, Akila. We might go to question 2. The second one is looking at a system strengthening question. What needs to change in wash systems, do you think, to more effectively prioritise menstrual health and hygiene? And I might throw that question to Sylvia to talk about her perspective from the project in school.
Thanks, Jules. I think what needs to change is, first of all, the way we work in our project is socializing and then introducing that menstruation is not taboo, is normal, and how to tackle the stigma and around menstruation. I think that's the key. We work with the government and then do some training with them. So I think the first step is to change the mindset of the government itself before they can support us. And we work in partnership with them, with support from women and people with disability, as well as our peer educators. So our peer educators has been also the key in advocating their rights, especially the boys, the girls that work with us. They help also to do some advocacy work with us to change the mindset for the government. And for the past 2 years, it has been quite successful in our project areas. We're able to set up the inclusive and MHH-friendly toilets and co-designing them with the people with disability, as well as getting the support from the government and the school itself. So the way we work is we provide stimulant fund, and the school and the government will then cover the rest of the cost of developing this inclusive and MHH-friendly toilets. So it has been successful, but I think the key is to change the mindset and getting them to think that how to tackle the stigma, that menstruation is normal. So I think that's how we work in our project. Thank you.
Thank you so much, Sylvia. That's a really great stepping out for us, particularly around the importance of really engaging government, so government stakeholders, so that they're taking leadership on it and understanding it as normal and natural. And once that happens, it's really tackling that stigma at the top levels to provide that leadership, and then how you're doing it at the different levels, at grassroots and community level as well. It's a multi-pronged approach. Thanks, Sylvia. Now, I think sorry to cut that part short, but we might have to move now to wider Q&A, and I do see that there's some in the chat about engaging men and boys, that there's quite a few questions on that. Could we invite Alice to talk about that from their experience on the Vanuatu project? Alice?
Well, from World Vision Vanuatu perspective, we've developed a curriculum that's targeted for women and girls and men and boys. So we deliver the training to specific staff who then go out and train people as champions in the communities. they've trialed that, and in a lot of places where taboos really strong, they've faced a few challenges, but the men are really keen to talk about menstruation and to say this is not only one person's business, but everyone's business, and trying to understand and address MHM issues. And we're thinking of also inserting the module into the carers package.
Thank you so much, Alice, for explaining that to us. It's great to see that, yeah, that the positive kind of role modeling that men and boys and how the project is supporting that process. It goes a long way in addressing the stigma and changing those attitudes towards menstruation, which is a big step. Thanks for sharing. Okay, we might just go to Q&A. Mia, did you want to let me know what questions?
Yes, I can, Joyce, but I think Sarah had her hand up.
Oh, sorry, Sarah. Go for it.
No, if you've got Q&A, please go to it. I was gonna, if there's time, I'll make one point, but please.
You can make a point this time.
Yeah.
Okay, no, I was just gonna add that I think one of the things, and this is from, working in a fairly traditional organization, right? We're not an NGO, so that's been important, is how do you explain the story to governments and to men on why this matters? Beyond the, why it actually matters at the individual level, I do think data can help. So for example, one study showed that if you provide menstrual cups to adolescent girls, you reduce the dropout rate by 4%. So if you're an educator, you can say, look, you're doing all these things to keep girls in school, but here's one other thing you can do. And explaining the links between the empowerment, between the sort of sense of self-worth and these broader, impacts on society and long-term employment and that sort of chain, I think really helps explain to them, what are we talking about? It's not just about our rights, it's also something that you need to care about for broader issues. So I think that's also important.
Thanks, Sarah.
Yeah,
sorry, Joyce.
I was just going to say, yes, thank you, Sarah. And in your presentation, you outlined that really well, providing that data, and it's key for getting government buy-in to show the evidence around that. I mean, as you said, that great quote, education is the social vaccine and also the economic one. Yeah, very good points. Thank you.
Thanks,
Okay.
Joyce. So there's some great questions in here from Min Coco, which are specifically for four of the presenters. So obviously you were piquing their interest, but I might just go to one from Christopher because it's for all panelists. Are there any examples of how we are measuring changes in attitudes and destigmatization relating to men and boys' attitudes to MHH in particular?
Who would like to have a go at that one?
I think at two levels, the measurement is happening, Mia. One at the level of, participation, what is the, extent of participation? Are they really coming around when the women and girls and when the issue requires, strong sort of, shall we say, conviction and action? So that's one part of it. The second very important part of it is to ensure their representation in everything that we do. The committees that we set up, the study groups that we set up, all the sort of, shall we say, the leadership development that they do. I think men and boys have to be, properly represented. Otherwise, they will tend to sort of slip back. Attitudes slip back even faster than anything else, And when they slip back, then they slip back forever, So one has to ensure that they are with us and that the process of transformation is a slow process. Early action does not symbolize a complete transformation. It's the ability to stay with the issue that will demonstrate it. And lastly, to actually look at what is called ownership, because many of these things, you have what are called, you have your own version of backlash, and you will not even know that someone has, gone back or recoiled because there's been a localized backlash, because there are many sort of, groups that allow things to grow up to an extent, and then like a dog on a leash, they pull it back, So you have to ensure that there is deep ownership. All of this has to be qualitatively studied. I'm not sure about the quantitative, tools that you can use, but case studies, definitely profiles, all of that, can be developed to measure men and boys' change in attitudes. Thank you, Jess.
Thank you so much, Akila, and highlighting that, the kind of longevity of the need to involve and consistently engage men and boys in the right spaces for change, because the risk of slipping back, attitude slipping back, that's a really good point. Akila, I must say you're great with quotes, and that early action does not guarantee transformation is fantastic. It really does sum it up.
We might have time for one more very quick question. And this was asked by Min Coco to Alice and Chloe. Most developing countries, including Myanmar, do not have a curriculum to support people with disabilities when menstruating. So Min found that very interesting and wanted to know if your organisation developed such a curriculum or could share anything on that.
Thanks, Min. That's a great question. We are in the pilot stage at the moment, but we recognise that it is a resource that would be useful in a lot of other contexts. So the plan is that it will be shared widely after we've gone through the pilot, just to make sure that we've got it right. And we recognise you might need to contextualise it a bit more for your context, but that's our plan, that we can develop it a bit further. There is, while it's not a carer's curriculum, WaterAid a few years ago did bring out a brilliant sort of assistive devices in WASH package that I'll try and find the link to put in the chat as well, to help with initial sort of thinking around how you can make WASH more accessible as well.
Fantastic. Thanks, Chloe. And everyone, I'm just handing over to Renee now to do the wrap up. Thanks, Renee.
Great, thanks Joyce, and thanks to all our fantastic panelists today. We really appreciate you making the time to join today's session to share your valuable insights and reflections on the menstrual health and hygiene approaches you're taking through your projects, and highlighting to us, what more is needed in order to make ensure stronger menstrual health and hygiene approaches. It's clear there is growing interest in this topic, and that it's not just today but every day that we need to be shining a spotlight on this important issue. And while there are still many challenges, and I think some of you have highlighted that COVID has also increased some of these, there are increasing opportunities and visibility of the importance of this as not only a priority issue for the WASH sector and WASH programming, but as many of you have mentioned, that it's an important cross-sectoral issue that needs to be addressed. You've also highlighted that there's not one approach to addressing this, and that a holistic approach is required. You've also highlighted just how important it is that we need to ensure that we are working with some of the most marginalised groups to ensure that the approaches we are implementing do not, approaches that ensure that no one is left behind. So yes, it's time to take action, and the Australian government is committed to supporting investment in menstrual health and hygiene to empower women and girls and transgender to manage their menstrual health and hygiene. And obviously today it's been great to have our partners sharing some of the ways that the Australian government is supporting this important issue. We really welcome the opportunity today on Menstrual Hygiene Day to bring together voices across our programs to raise awareness around the importance of menstrual health and hygiene. I'd like to say a big thanks to the Water for Women Fund Coordinator team, particularly Jo Spott, Mia Cusack and Emily Ella for their coordination of this fantastic event. Thank you, Joyce, for moderating the panel. And I'd like to thank all the participants for joining this webinar today. It's fantastic to have so many of you here. I'd also like to congratulate the Water for Women program for the launch of their learning brief that they're about to launch on menstrual health and hygiene today. I really look forward to reading this. I hope you found the panel session informative and can draw on the fantastic examples and approaches in your work and continue working to break the silence, raise awareness and change negative and social norms around menstrual health and hygiene. Before I hand back to Jo Spott to say a few final words and launch the learning brief, I would also like to make a plug for an exciting new campaign that DFAT in partnership with Water for Women is launching with DefX today, called Washworks, Water and the SDGs. And if you have a look at your screen, there's a slide there with a link to that. This series will explore the way in which water, sanitation and hygiene efforts intersect with other development challenges, specifically in low and middle income countries, and feature work across Australia's water development portfolio, particularly our Water for Women program, and will run from now until early next year. We're also very excited that a range of other international partners have also joining with DevX to showcase their important work in water and wash as part of this series. So thank you very much. And now I'd like to hand back to Joyce to make some concluding remarks and to launch the learning brief. Thanks, Joyce.
Thank you so much, Renee. I think, and I think you've mainly covered it, so I won't have a lot more to say, but I would just like to say a big thank you to the panelists for what you've shared with us today, and also to all of you for making the time to be part of this event and sharing your wonderful insights and experience. We hope you enjoyed the session and it gave you a lot of food for thought. Yeah, so this learning brief has been a collaborative effort with Water for Women Fund partners, and it really provides rich learning on the diverse approaches being undertaken to ensure access to safe and dignified menstruation through improved wash infrastructure and through addressing stigma and harmful norms. So some of these examples you've already heard about today. And of course, this would not have been possible without the work of Maritza Kapokieros from GHD, who undertook an internal review for the fund across the projects. And this really helped us to learn more about what was happening across the fund. So thank you very much, Maritza, because I think she's here with us today. So this learning brief, I think the links will be in the chat along with social media links and handles from Mia, and it will also be sent in a wrap-up email to you all. And the wrap-up email will also include the presentations and a resource list for further reading, the video recording, and more information on the DevX Wash work series that that Renee just discussed. So, without further ado, in terms of thinking about the theme for the Menstrual Health and Hygiene Day today, about being time for action, I thought we could finish on that note. So I would like to invite you all to go to the Mentimeter link, which is at the top of the screen, and enter the code. It's also in the chat. And if you could answer, I would invite you to answer the following question. How will you make menstrual health and hygiene pivotal to your work? And just a reminder that responses are anonymous. So that's just entering going to the link, entering the code and answering, how will you make menstrual health and hygiene pivotal to your work? Because it's time for action. Thank you. And if you are having trouble accessing Mentimeter, also feel free to pop it in the chat as well. Ensuring it's included in all aspects of inclusive WASH programming and learnings. Yes, a number of the examples showed how that has been, that is being done. Comms, and sure we have more events and fantastic sharing. Okay. Talking about it, especially when it's uncomfortable. Very good point. Yes, I think that's key, isn't it? Ensuring it is included in all of our country program documents and that we are building capacity in the sector, working with others and putting women at the centre. Fantastic. Explaining it to senior managers. Yep, getting senior leadership on board is really key. Including menstrual health beyond just WASH projects. So also having that cross-sectoral collaboration, very important. Regulation and budget support from government, critical from a system strengthening approach. Ensuring WASH and MHHM is incorporated as a fundamental feature of housing and settlements development program as a key component of adequate housing. Good point. Raising greater awareness amongst all stakeholders, more partnerships with duty bearers. Yeah, that key role that government plays. Integrating MHH and people with disabilities in all programming and daily life. Yes, critical. Lots of fantastic actions there. Target boys and males too, so they can be supportive partners and allies. Critical for changing norms. Yep. Ensuring toilets are inclusive. Discussing MHH further with local partners. And that's great. Yeah, start that discussion, start that conversation. Normalizing conversation around it. Yeah, the more conversation there is, the more it'll be normalized. And working towards inclusive toilet infrastructure in the workplace. Yes, that's critical as well. Wow, there's lots there. Lots of great actions to take forward. Still going. Yeah, thanks, Mia. We'll share this Menti with the follow-up email as well, because there's some great actions to take forward. Okay, I think we have come to the end. And I want to thank you all for your time. And yes, good luck in taking those actions forward. It's time for action. Thank you very much.